Good afternoon, everyone. This is Dr. Jeff Gelblum here today with basically what has become our weekly COVID roundup, mix-up, mash-up, basically recapping what new information has come about over the past week, because as we've discussed before, the COVID evaluation and treatment, this is a moving target. So we neurologists, as well as other physicians who are dealing with COVID, we're watching this data and we're watching the information as it basically unfolds on a daily basis. So my goal is to keep you up to date with all the new and exciting information to keep us safe and to hopefully row our way through this pandemic, because believe it or not, there is light at the end of the tunnel. First news of the day that's very, very exciting has to deal with vaccination of pregnant ladies. The World Health Organization has announced that at this point in time, there is no contraindication to receiving vaccine if one is pregnant. And that is terrific news because obviously for those women who are pregnant and have underlying risk factors of diabetes, which of course can occur during gestation, that's called gestational diabetes, or for those women who are asthmatic, or perhaps having underlying immune disturbances, for those pregnant gals, vaccination, if it's not contraindicated, is a great idea. Well, guess what? Today, that contraindication has been lifted by the World Health Organization. Now, I want to remind you that the official labels for the Pfizer vaccine and the Moderna vaccine, which at this point are the only two vaccines available in the United States, that those current labels do not say safe for pregnancy. So if you're looking for it in the package insert, or when you go and get your vaccine and you ask the nurse who's giving you the vaccination, is this approved for pregnant ladies? Obviously, that nurse is not going to be able to say this is approved for pregnant patients because that's not how the studies were conducted. And remember, package labels, indications, that printout that you get from Walgreens, it only reflects the clinical trials that were done. And so far, the vaccination trials that have been conducted were not conducted with pregnant women. But at this point in time, due to the overwhelming number of vaccines which have been given out, and I think today it's at least in the US, it's something like 30 million vaccinations have thus far been given out. So far, we're not identifying any fetal risks, and the animal studies that have been done with both the Pfizer and the Moderna product, again, the two products that are presently available here in the U.S., the animal studies have not shown any injury to the fetus, fetal mice or other fetal hamsters or whatever fetal animals they look at. So far, there do not appear to be any birth defects associated with pregnant mothers who have received the vaccine. So as of today, the World Health Organization has basically said no identifiable contraindications to vaccination in the pregnant state. So obviously that's a decision that any pregnant woman has to have with her doctor. And the discussion that has to be had is, well, look, if I'm in perfect health and I'm pregnant, do I really need a vaccine? Well, that's a risk-benefit way that has to be done with the obstetrician. But on the other hand, if you're pregnant and you've got diabetes and you're obese and you've got hypertension, then you are at a higher COVID risk. So at that point, it may be very worthwhile to say to your doctor, look, is it okay if I get vaccinated? And really, there's no contraindication at that point. So first message of today, which is extremely encouraging, is that the vaccination is not contraindicated for pregnant ladies. So that, to me, is great news. And remember, it's all a matter of reaching herd immunity. We've got to get as much vaccination out there as possible, because the more people that are protected against COVID disease, obviously the quicker it's going to go away. And as these vaccine numbers tick up, you're actually seeing the COVID hospitalizations and death rate go down. So that's why I'm saying I think we've turned the corner in terms of this pandemic, and you're going to see fewer and fewer hospitals rates, fewer and fewer death rates, because the population is getting vaccinated as quickly as possible. Now, obviously, there are some considerable glitches in the rollout of the vaccine. I had a patient who waited in line for several hours to get the first shot and then double that to get the second shot. That was down here in Dade County, where things tend to be not as well organized as other places. But, these are the glitches and the gum-ups in the works. But if you actually look at the distribution of the vaccine, it's better now than it was last week, and next week will be better than today. So as I see it, there is light at the end of the tunnel. I keep on getting questions about, is it worthwhile to be vaccinated? So let me say this. For those of you who have been sequestered at home by virtue of the pandemic, you haven't been out, you've been doing everything safe, you've been doing a good job wearing masks, washing hands, staying away from other people, maintaining social distance outdoors. For those of you who have been in that environment, you may not be on the front line of seeing what's going on with COVID-related illness day in, day out. But here in this office, either from what I'm seeing in my waiting room or what I'm seeing on the computer screen where people are coming in via telehealth, we are seeing a lot of COVID-related illness. And I've discussed this previously. There is this whole concept of the long haul, meaning people who've had the acute COVID virus infection for a couple of weeks, but then they suffer from residual problems, residual difficulty breathing, residual difficulty with fatigue, residual difficulty with sense of smell and sense of taste. And as a neurologist, I really am in the front lines, along with my colleagues, of seeing a lot of these chronic long haul symptoms that are attributable to COVID, which brings us to the major point of today's discussion. Is COVID a neurological disorder? We've heard a lot about fever. We've heard a lot about cough. We've heard a lot about turning the patient and making sure you sleep on your stomach if you have COVID, to give the lungs maximum ability to expand while you're breathing. We've heard a lot about that. You have not heard a lot about COVID-related neurological problems. And I'm here to tell you today that there are a lot of COVID-related neurological problems. So as far as I'm concerned, COVID, in addition to attacking the respiratory system, certainly does attack the nervous system. In fact, the heralding feature of a coronavirus infection is loss of sense of smell. So what is that all about? Well, we know that there are 12 cranial nerves that control everything that goes on up here, from eye excursion back and forth, to smell, to speech, to swallowing, to hearing. Those are called the cranial nerves. And if you look at how COVID hits the body, basically the nervous system is first point of entry. Because as it goes into your nose, that's typically where the COVID virus latches on with its spikes, or as it goes into the oral cavity, also where the COVID virus spikes latch on, those areas are neurologically innervated. They are controlled by cranial nerves, the 12 cranial nerves, and those nerves fall under attack at the time of COVID illness. So what are the different cranial nerves? What are the different areas of this part of our body that is neurologic, obviously? What are those nerves that are typically involved with a COVID virus attack? And that is why I can tell you that coronavirus is a neurological disorder, and that's why we neurologists are really at the forefront here. And I'm telling you this not to scare you, not to heighten your concern, because I know you're all concerned, but just to let you know that there are some residual problems with COVID that go above and beyond the respiratory system. Again, hopefully compelling you to all get vaccinated, because that's my overall mission statement, is to make sure that all of my patients, my friends, my family, that everybody gets vaccinated, because as a neurologist, we are seeing neurological complications of COVID. So you say to yourself, well, how does this happen? Easy how it happens, because the COVID virus is basically a sphere with spikes on it that hits receptors, basically little locks, and the COVID virus is almost like a key that goes into those little locks on these cranial nerves. So let's go through the various cranial nerves that are involved with an acute COVID attack and some of the sequelae of the COVID attack, the long haul effects. First cranial nerve, in fact, it's called cranial nerve 1, the smelling nerve. Basically, the olfactory nerve is cranial nerve number 1. And that nerve is the first thing, basically, that people experience when they have been hit with COVID. In fact, before you even get the respiratory symptoms, you'll get cranial nerve 1 involvement, which is olfactory involvement. And that's typical, not in everyone, but it's a typical presentation. Not so much in kids, but certainly in the adult population. So when we talk about cranial nerve involvement, we definitely talk about cranial nerve 1, which is the smelling nerve, the olfactory nerve, and that tracks right back into the brain. And as I always say, you only want to take a neurological lecture from a bald neurologist because we can point to all the areas that are involved, so it's great from a neuroanatomy perspective. So cranial nerve 1 is the first nerve, literally the first cranial nerve, and that's the first thing that typically gets hit with a coronavirus attack. In my experience, that is very typical, very common, and the return of that smelling injury can often take several weeks, well beyond the duration of the actual respiratory symptomatology. In fact, not only several weeks, but several months. We are now almost 11 months into this pandemic here in the U.S., and I can tell you that many of my patients who were attacked with the virus in May, June, and July still suffer from some residual anosmia, loss of sense of smell. In fact, I have a chef that is suffering from an anosmia, and as you can imagine, that's a pretty catastrophic occupational disability if you can't smell the food. So in that regard, cranial nerve 1, very, very important. What's another cranial nerve that is typically involved? Because as I told you, there are 12 cranial nerves. Cranial nerve 7, which is the facial nerve. Oftentimes patients will develop a facial palsy as a result, like a Bell's palsy, as a result of the coronavirus attack. Now, I know some of you have seen that goofy Facebook video of somebody who got a vaccine and developed Bell's palsy. I can tell you that Bell's palsy is a common phenomenon. It occurs commonly in viral attacks, so COVID is no different here. But the likelihood of developing a Bell's palsy from the vaccine is actually less than the likelihood of developing a spontaneous Bell's palsy. So in that regard, if you see anything on Facebook about somebody developing a facial weakness or a Bell's palsy from the vaccine, that has not been shown to be the case. But we have seen Bell's palsies as a consequence directly of a COVID attack. We also see vertigo, room spinning sensation, and that's a manifestation of cranial nerve 8. So for those individuals that are suddenly experiencing disequilibrium or unsteadiness, sometimes this can persist after the acute coronavirus injury. So again, a cranial neuropathy, a cranial nerve disorder directly attacked by the COVID, because the COVID enters through up here. It comes in through your nose, it comes in through your mouth, so it makes absolutely logistical, geographic sense that these would be the first structures that would be involved, and they are involved. So that's a very common cranial nerve. Vertigo, cranial nerve 8. Cranial nerve 5, which is the facial sensory nerve, otherwise known as the trigeminal nerve. It is very, very common for patients to develop facial numbness. Sometimes it goes so far as to develop what we call trigeminal neuralgia, tic douloureux. That's French for painful tic. And in that setting, patients will develop a unilateral numbness and pain, such that even when you touch it right here, it can be extraordinarily painful. So that's cranial nerve 5. So basically what I'm doing is I'm taking you through the neuroanatomy from top to bottom of the skull to let you know where coronavirus typically hits the nervous system. Now, we think that the pathology is that there's swelling in the little holes where the cranial nerves exit from the skull cavity, and it's that swelling, that inflammation that actually causes the cranial nerve injury. So again, one of the commonest questions I get is, well, what the heck does a neurologist have to do with COVID? And I can tell you each and every day, we neurologists are seeing cranial nerve injuries attributable to a COVID virus illness. So your question has to be, well, if we don't have a direct cure for those injuries, is there treatment that can be provided? And the good news is absolutely yes. So for example, let's say, I know Megan is concerned about, what about a facial twitch from COVID? Well, again, the facial nerve is the 7th cranial nerve. And if you're developing a facial twitch or an eyelid blink, otherwise called a blepharospasm, that could be due to an injury of the facial nerve or swelling of the facial nerve hole as it comes out of the skull right back here, and that controls the facial nerve. And twitching can be a residual impact of the COVID virus, and there's ways to treat this. So you say, well, how do you treat it? Well, first of all, we neurologists have been treating Bell's palsy, have been treating trigeminal neuralgia, and have been treating problems of facial pain and headache for many, many years. We've got great treatments. So if you are suffering from any of these residual long haul symptoms, or any acute symptoms for that matter, related to a COVID attack, please contact your neurologist. Why? Because we can treat this. And the problem is, if you let it fester, if you let it stay for a long period of time, it can become its own disorder. So COVID can go away, but if you've got a residual trigeminal neuralgia, a residual facial pain, or a residual eyelid twitch, and if you don't do anything about it, then it can take on a life of its own. And that's why it's very important that anyone with these types of symptoms seek neurological evaluation as soon as possible, because the sooner we get control of these sparks going on in the cranial nerves, which we can do as neurologists, the quicker we get control of this, then the better off you're going to be long haul in order to avoid a chronic disorder well after the coronavirus illness heals up. So the point that I'm trying to make here is coronavirus indeed is a disorder that can clearly affect the nervous system first and foremost before it ever hits the lungs or anywhere else. And as a result, it can cause some pretty significant problems. If you're a chef with loss of sense of smell, big problem. If you have to do presentations and you've got a facial twitch or a facial weakness that looks like a Bell's palsy, huge problem. So the quicker you can get neurological attention, the better off you're going to be, because we can intervene very quickly to make sure that these problems, the symptomatology, is alleviated. So I highly recommend a neurological evaluation wherever you are if you're symptomatic of any of these disorders. So I've spent a lot of time this morning talking about the cranial nerve stuff. What else goes on neurologically having to do with COVID? Well, we neurologists have seen a lot of actually cerebral brain things that happen with COVID. Everything from personality changes to short-term memory loss, to excessive daytime drowsiness, to chronic insomnia where your sleep cycle is all disrupted so you can't sleep at night and you're falling asleep during the day. And as you can imagine, once the coronavirus clears up and you've got to go back to work, if you are having problems with attention and focus, short-term memory, sleep cycles, this can be very disabling. And again, these are things that we neurologists have dealt with for years, not related to COVID, but we've dealt with these symptoms for a long time. So these conditions are very amenable, very responsive to treatment via medication, and we can alleviate these symptoms. And I do recommend, again, that if you are having these symptoms, that you seek treatment as early as possible. Again, we're not talking about a COVID cure. What we're talking about is utilizing an approach that controls the disabling symptomatology associated with COVID, which harkens back to the whole idea, if you get vaccinated in the first place, then this whole discussion is moot. So first recommendation of the day before you call a neurologist is to get your vaccination. If you've already been hit with COVID, we're talking about some of the neurologic manifestations. So we do know that COVID not only affects the cranium and the brain, We also know that it affects the peripheral nervous system. So what do we mean by that? Those are the nerves that control sensation in the fingers and toes. And one of the commonest long haul manifestations of COVID is what we call neuropathy, painful nerves. So numbness, tingling, pins and needles. Now, for any of you who have a loved one, or if you yourself have a history of diabetes, you know that diabetic neuropathy is a very common disorder. Well, the good news is we neurologists and other pain management specialists have dealt with neuropathic pain for years. There are lots of good medications that we can use to help with this common long-haul sequela of coronavirus. So again, if you've had coronavirus and you're watching today and you're saying, wow, he's really talking about a lot of the things that I experience, then these are all very treatable. So it's important that you get treatment as early as possible, because if you've got a neuropathic pain associated from coronavirus, meaning your fingers are tingling or your toes are burning or you're feeling achy in the feet, and the COVID virus is long over, but if you're still having these symptoms, it's extremely important that you get yourself treated. Why? Because these neuropathic disorders can often take on a life of their own. So if, let's say today, you've got a COVID-related neuropathic pain syndrome, 5 out of 10 on a pain scale, and you decide to do nothing about it, 6 months from now, it could be 7 out of 10 on a pain scale, because they take on a life of their own. It's kind of like scraping an irritated electrical cord or a frayed electrical cord. So it starts to spark, and that's actually what happens with the peripheral nerve. The COVID virus attacks the coating of the peripheral nerve. That's called myelin. And what happens is that myelin can sometimes grow back in an abnormal way. And if it grows back very abnormally, then you run the risk of developing a permanent neuropathy. So again, I'm not here to scare you. I'm here to say if you've got the symptoms, the sooner that you seek neurologic evaluation, the better off you're going to be, the quicker it'll be to treat you, and the better off you're going to be down the road. So these are things that often take on a life of their own, which is very common with neurological disorders. So that's why it's important to intervene as quickly as possible and try and stop the process from taking on a life of its own and evolving. One of the other signs and symptoms that we see as part of a COVID-related illness is a spinal cord disorder. Oftentimes we'll see patients developing some weakness and numbness of the arm or of the leg. We call this a postviral myelitis, meaning inflammation of the spinal cord post-viral. Again, neurology has dealt with this for many, many years, unrelated to COVID, caused by other viruses, influenza virus, etc. So in that regard, quick assessment, quick treatment will prevent long haul and long-standing disability. So all of these things are extremely important to watch for. And I can tell you that a lot of times, and if you look on the media, if you watch the news every night, or you're on Facebook all the time, you will see people talking about the respiratory impact. But it's important that we all are aware that the coronavirus attacks the nervous system at the same time that it attacks the respiratory system and the cardiovascular system, as well as the blood system. We all know about the tendency to develop a stroke from a severe coronavirus infection because of the elaboration of this protein called antithrombin. So we're not going to get into that discussion. That's a very technical discussion. But suffice it to say, we're all aware that certain severe coronavirus patients have had a stroke syndrome, and that's because of increased clotting in the blood as a direct consequence of the viral attack. So yes, indeed, coronavirus is a neurological disorder. Yes, indeed, the best thing to do is to get vaccinated to prevent any of this. But yes, indeed, we neurologists have dealt with all of these signs and symptoms for many, many years. So if you are symptomatic, if you're having difficulty with recovering from coronavirus, and as we know now, tens of millions of Americans have had coronavirus. So the things that I'm talking about are not rare. they're out there in the general population. So if any of you have a loved one who is suffering from any residual vertigo or cognitive problems or irritability or sleep disturbances or nerve pain or face pain, it's very important that that loved one make their way to a neurologist, because these are things that can be treated, and we have treated them before. Now, one of the things that I do want to talk about, since I have Jacqueline tuning in right now, hello Jackie, is migraine attacks. And it is not unusual for patients who have coronavirus to develop a severe uptick in their migraine frequency and duration. Now, back in the day, if you had a migraine and it was sporadic, we would give a medication like Imitrex or even a couple of Aleve and an extra strength Tylenol, and that would do the trick. But it's not unusual for patients who are in the midst of a coronavirus attack or as a residual sequela of that infection to develop what we call chronic migraine. And again, bad disorder, but easy to treat. So for those of you who are having any of these types of chronic headaches that are there and weren't there before coronavirus, there's help. So purpose of today's discussion, again, not to scare you, not to say, oh my gosh, this is the worst thing since the bubonic plague. Not so. First of all, we've got a vaccine. Second of all, if you get really, really sick, we've got some great new treatments available in the hospital for you. That's why the incidence rate of infection is going down. The hospitalization rate, I should say, the incidence rate is not going down, but the hospitalization rate is going down. The mortality rate is going down. So people are not getting hospitalized and not dying at the same rate as they were just last month from coronavirus. So that's all good news. And then the last thing that you need to bear in mind is all of these symptoms that we've talked about neurologically today are all amenable to treatments. We neurologists have great resources available to us in terms of different types of medications and therapies that we can give you that are all FDA approved, nothing experimental, that can alleviate these types of symptoms. And the main thing that you have to bear in mind is, as with any other disorder or disease, the sooner you treat it, the better off your prognosis, the better off your overall outcome. So we've shared a lot of information today, a lot of discussion points. Major issue is please get vaccinated. The neurological impact of vaccination, meaning what's the side effect of a vaccine in terms of neurologic functioning. At this point, basically a little bit of headache, a little bit of myalgias, muscle aches, but nothing serious. In fact, the latest data show that with COVID vaccine, out of 1 million doses given, 11 people had a significant side effect. So those are odds I'll take every day. I don't get those odds when I drive home from work. I don't even think I get those odds if I have a Jiffy peanut butter sandwich, because I probably have a greater chance of choking on a peanut than having a problem with the COVID vaccine. And if you've seen any of those goofy Facebook videos about the lady with the funny walk after the vaccine, that's all fake news. First of all, the lady with the funny walk, that is not an organic walk. Give me some time and I'll be able to recreate that funny walk, but I don't want to do it today because I'll mess up all the stuff on this desk. So we are looking with an extremely safe vaccination program. The data with it are superb. The efficacy is superb. The safety with it is superb with regard to the vaccines. And if you've had COVID and you are suffering from any neurological symptoms that are persistent, please reach out to your neurologist. If you don't have a neurologist, I'm happy to help you. We're doing telehealth. So Hillary, I know you're not down here. You're up north. And Renee, I know you're up in Baltimore, where you're probably home now making, hopefully, good crab soup on a cold, snowy day. If you need neurological assistance, we're open Monday through Friday to do telehealth consultation should the need arise. So I truly appreciate your time and attention today. I look forward to speaking with you on a consultation, face-to-face telehealth, should the need arise. And if you need to reach out to me, I'm available to you via email, jgelblum@fcneurology.net, as in First Choice Neurology, jgelblum, fcneurology.net. And I look forward to helping you in any way that I can. And if you need some focused time and attention, our office is open for telehealth services. So I hope you've learned a lot from today's discussion. I always like to teach, and hopefully the information that you got was maybe a little bit over your head, which is great. That means you have to go and look something up and ask me a question for our next telehealth, where I hope to bring you all the updated information as it becomes available on a daily basis. And on that note, I appreciate your tuning in today. I look forward to taking any of your questions via email or in the context of a telehealth visit. And if you're up north, enjoy the snow. And if you're down here in Florida, enjoy the sunshine. And until you get vaccinated, obviously continue with social distancing, mask wearing, and vigorous hand washing. And on that note, I'll wish you all a great afternoon. Have a great day, everybody.